Good afternoon. Thank you for joining us. Today is an important milestone in our fight against COVID-19. You have been living with COVID-19 for a little more than 3 months now, living with the restrictions and the limitations that we've asked you to bear in this fight against this virus. Thank you for your efforts. You have sacrificed a lot for the sake and benefit of our community, and your commitment has made Hawaii the leader nationally in containing the spread of COVID-19. June 30th was also the end of the state fiscal year, and I know that many of you are concerned about your financial situation and the finances of the state of Hawaii. These are two of the most important issues we face today, and we've been working hard to keep Hawaii safe and sound, safe from the virus and financially sound. So first, I want to talk about being safe. Today we had 7 new cases. This is after a week of daily double-digit cases here, especially in Honolulu. We have had multiple households and workplace clusters, and the virus has spread when people have gathered for potluck dinners, a birthday party, and other indoor activities. Once again, just want to remind everyone that we need to continue to take personal responsibility in fighting the spread of COVID-19. There are indications here on Oahu of wider community spread. Right now, these higher case counts are manageable, and in fact, we did anticipate them. But everybody has to continue safe practices if we are to remain the lowest in the nation per capita for transmission and the fewest fatalities. Most importantly, we need to maintain this so we can begin to reopen our economy moving forward. With me today is Lieutenant Governor Josh Green, who will provide an update on the healthcare situation and healthcare capacity here in the islands. Also with me is Dr. Bruce Anderson from the State Department of Health, who will give you an update on the cases over the past few days. Next, I did want to talk a little bit about our finances. I know you'll want to know that is Hawaii financially sound? All of you have done a great job in fighting the virus, but it has come at great cost. Your health has always been our first priority, but as governor, I am responsible to ensure that we can start talking about the looming financial crisis. You have a right to know, and I'm committed to give you the facts and keep you informed. You've seen in the news, as a result of our imposing the 14-day mandatory quarantine, more than 200,000 of your neighbors and residents have lost their jobs and gone on unemployment. Many of the businesses had to close, some temporarily, but some will never reopen. You probably know someone, a friend, a neighbor, a family member who is facing challenging financial times. And as difficult as it has been, we haven't felt the full financial pain yet. Our finances have been kept afloat by an infusion of more than $4 billion in federal money. Thank your congressional delegation, Senator Schatz, Hirono, Congressman Case, and Gabbard. They've done a terrific job in providing support for residents and businesses statewide, but the federal money is drying up. The Paycheck Protection Program, money that supported thousands of Hawaii businesses in keeping many of you at work, will begin to start to run out at the end of June. And many of you have received your $1,200 stimulus payment directly from the federal government, but that's a one-time payment. Those of you who filed for unemployment have received an additional $600 per week from the federal government, and that increase will end during the end of July. So I did want to have this opportunity to talk a little bit about the state finances. As you know, June 30th marked the end of our fiscal year. For June, as expected, last year we collected $644 million in taxes in June. This year, we collected just $483 million. That's $160 million less for the month of June, or about a 25% reduction. If you look at the end of the fiscal year, in the previous fiscal year, the state collected $7 billion in total tax income. And this year, in the fiscal year just ended, we ended up collecting $6.5 billion, or $500 million less than we did in the previous year. That's a reduction of 7%. But all of you know that we were running along very fine through the end of the year on record pace. January, February, March, the revenues had no impact from this COVID pandemic. And then we saw the degradation in April, May, and now finally June. So we do know that COVID-19 will have a significant impact on the state's finances. So we went from a record year to a significant loss in a matter of 3 months. As you look at the revenue projections, the Council on Revenue has just issued their updated forecast for 2020 and 2021. Based on their assessment of our economy, they projected $2.3 billion less in tax revenue for the next 12 to 15 months. This is a huge challenge for all of us here in the state of Hawaii. And we are working very hard to look at all of the options. The state's budget is fixed, and we are required to have a balanced budget. We can't create or print money. It is all within the funds that we collect. So we are looking at every opportunity. Everything is on the table in order for us to balance the budget. This includes trying to find more money within the funds that we've already collected. And unfortunately, it also means that we'll have to look at potential cuts to the budget. I want to assure you that our planning and decisions will be based on facts and the numbers that we see. We are facing a challenging future, and we will attack it head on. There are no easy answers, and tough decisions will be needed to be made in the next weeks and months ahead. As you know, it is important to remember that we do believe this shortfall is temporary for a period of time. As we begin to reopen our economy and bring back a Trans-Pacific guest, we know that that will help improve our financial situation. We also know that there is a lot of work in producing a vaccine and better therapeutics which will help us in the fight against COVID-19. So just want to assure all of you here in the public that there is a light at the end of the tunnel. And as we know, we have faced as a community challenging times in the past and have always emerged working together, stronger and more vibrant. So just want to remind everyone that this is a marathon. It's not a sprint. We need to be committed to keeping Hawaii safe and sound. We need to take personal responsibility in order to win the battle against COVID-19. It's the best way to fight the disease. So please continue to wash your hands, wear your masks, avoid large gatherings, stay at home if you feel sick, keep your children home if they feel sick. Avoid gatherings. Do everything that you can to help us contain and control COVID-19. So please take care of yourself, take care of each other, and most importantly, help to take care of our community. Thank you.
Thank you, Governor. Next speaker, Lieutenant Governor Josh Green.
Aloha, everyone. Thank you, Gov, Director of Health. So I'm going to just kind of give an overview of our healthcare situation, and I hope it'll prove reassuring to people. We're actually doing very well on the healthcare side. The uptick we've seen in cases over the last few weeks has been concerning for many. When we see numbers like 25, 24, 27, it is, of course, disconcerting when we're used to seeing cases numbered at 0, 1, 2. But things have changed. We have opened up our Kama'aina economy, and it's providing a lot of people an ability to work again here in the state. We have not had a significant consequence at our hospital level, which is good news. Our team is in constant communication with leaders at Queens, Hawaii Pacific Health, Kaiser, the community hospitals across the state, our community health centers. We meet with the medical community every single week on Tuesdays, and we watch these numbers every day. So I want to reassure people that a minute doesn't go by where we're not making sure that we have health care that will be adequate for our ohana and our kupuna specifically, who are at greatest risk if a COVID outbreak begins to surge. Now, we were approaching crisis levels all across the mainland. It's a concern. You've seen what's happened in Texas, in California, but we have alert systems here that tell us whether or not we're going to see that kind of situation here in our state. So we can make kind of reassessments and readjustments constantly, and we're doing better than any other state, if I could be direct. I was on call this weekend in Hawaii. I saw 2 individuals come in for tests. Both were negative, but it is something that happens even in our very rural areas across the state. And so every part of our state and our healthcare system has been engaged to make sure that we're safe. A couple quick updates, though. People wonder, can we take care of each other? So our intensive care unit beds, right now, as of this minute, 120 out of 244 are in use. That's 49%. But it's important to note that only 3 of those individuals in the ICU are COVID patients, COVID-positive patients. So very, very few people are requiring intensive care unit level care with COVID right now in Hawaii, and that's a blessing. The most significant need someone needs if they're very sick is a ventilator, a breathing tube. And I've talked about this before, but here we go again. Ventilators, 53 out of 459 of our ventilators, 12%, are in use right now, but only 2 of those ventilators that are in use are for COVID-positive individuals. So I can reassure you that for now, we have a lot of capacity. In fact, more capacity than anyone else in the country based on percentage. But it is something that we always worry about when we talk about any visitors coming to the state. How many people have been hospitalized through the whole experience of COVID? Well, in Hawaii, the total number cumulative to date is 115 individuals have been hospitalized. And as you're all aware, we have had 19 fatalities. Virtually all of them, and I defer to Director of Health, but virtually all of them have been elderly and had chronic disease. So those are the highest risk individuals. So we never can let our guard down, but I want to reassure you that we're doing very well. Even just recently, though there's been a surge, a total of 32 individuals since June 1st, that's the last 36 days, have been hospitalized for COVID-related illness. It's a little higher than the first few months, but it's not something at all that we can't take care of. As I've shared before, we have over 2,500 hospital beds in our state. So these are important things to remember. But as far as fatalities go, we have the lowest mortality rate in America. It's 1.3 per 100,000. Certainly no consolation if it's someone dear to you or to your ohana. But we're constantly aware that we are doing better than other states, and we also are able to learn from other states. It's something that Bruce was pointing out to me, and I agree with. We're able to learn in advance what's going on in Alaska, what's going on in Texas, and we can try to avoid the mistakes that they may have made. 77% of the individuals that we have in our state who have had COVID have been released, recovered. That number was higher, but that was before the surge, of course. And it's been pointed out, too, that 85,673 people have been tested. So we've even done more tests than that, but that's a large number of people now in our state that have been tested. Keep in mind, even with those good numbers, we're even able to surge our capacity to a degree. Many of our hospitals can surge their teams and their capacity up to 30%. For instance, Hilo can surge up to 30% of extra beds if, God forbid, they needed to do that. A couple other healthcare points I wanted to mention. there have been a lot of advances in treatment, even in this short time, just the 5 months that the disease has been around in Hawaii and 7 months globally. So we're taking those advanced treatments and using them in Hawaii. The current treatments include convalescent plasma. That's plasma from individuals that donate it when they've got antibodies in their blood. We've used that to treat people in the state of Hawaii if they're very ill. There's a medicine called remdesivir, as you've probably heard. We have enough of that to go around in our state, in all the counties, if someone is on a ventilator and is very sick and needs it. It has decreased the length of stay in hospitals by 30%. And finally, an old medicine called dexamethasone, 6 milligrams a day intravenously for 10 days, decreases the mortality rate. So my medical hat, that is a very good thing that we have available to us. So, well, I know everyone's focused on increasing daily numbers, though today it was just 7, I think, which is good news. I do want to reassure everyone we're in good shape. So whatever decisions that the Gov needs to make with the input from the mayors and the Director of Health, we are preparing ourselves no matter what to be as safe as possible as life goes on, but also we're preparing and updating you that our hospital system, because of the great work of first responders and healthcare providers, is going well. And I'll just kind of wrap up. Look, everyone, please recommit yourself to wearing masks. Follow the lead. Very good advice from all of the mayors, Mayor Caldwell, Kawakami, Victorino, Kim. They're very focused on that. The Gov has been completely our champion, and Director of Health. Wear your masks. If you're not wearing a mask and you're near somebody else, you're putting them at risk. And though it may be cliche, people say, I hate wearing a mask. Try wearing a ventilator. That is infinitely worse, and it puts your life at risk. So please, please, please wear your masks. Refrain from, decreasing your social distance. Really commit yourselves to that, and we will do better than any other state. You guys have done something extraordinary. Obviously, the economic consequences the governor is on top of, and we will adjust, but we want to stay alive first. And so my focus will keep being health first, and we'll adjust to the new reality, which is COVID in 2020. Thanks, everyone.
Thank you. Our next speaker is Bruce Anderson, Director, Department of Health.
Good afternoon, everyone. We had 78 new cases reported over the extended 4th of July weekend. Most of these cases actually were identified through contact tracing, but what's troubling is that many of the cases were newly reported lab results of infections not associated with current cases or clusters. This is an indication that the virus is circulating in our community and spreading, particularly here on Oahu. This rise in cases is concerning as we continue to open up businesses and we consider opening up schools again, bringing college kids back to Hawaii, and of course welcoming visitors from other states with high rates of infection and large outbreaks. We certainly need to be more vigilant about the need to wear face coverings, keep that social distancing, the physical distancing of 6 feet, and wash our hands, and by all means, not to go to work or school while you're ill. That's what's going to prevent the disease from circulating. We can do all the contact tracing in the world, and we're not going to be able to prevent the spread of the disease. Those things you can do personally are really what are going to make the difference. You've heard us all talk a lot about clusters, and these are groups of multiple cases that all have a common source where there's an association between the cases. All of the recent clusters have been associated with people not wearing masks and not practicing social distancing. They have occurred in workplaces, in gyms, and during social gathering, inside and outside. I'll give you a sampling of just from this last weekend, the types of activities that have been associated with these outbreaks, these clusters. We had reports of people attending family gatherings without a mask. That included birthday parties, funerals, card games, beach parties, even Father's Day parties were associated with some of these cases. People working out at a gym with inadequate physical distancing and without masks. 9 people were so far associated with a large class that was held indoors. The gym's now closed, and everyone who has been exposed or may be exposed has been notified. So fortunately, I think that situation is now well under control. People working often are very good about wearing their masks when they're at work, But we had a situation recently where they were wearing their mask at work, and they would go out for lunch together and forget to wear their masks and then become exposed. Training programs. We actually had a training program. Hawaiian Airlines conducted this, and individuals were admittedly not wearing face coverings, and altogether we have now 12 individuals who have been identified as positive cases associated with that, including 2 family members of the cases. So many of the cases we're seeing today are the result of lax preventive measures. No one is safe or immune from the virus, which has the potential to overwhelm our hospitals and healthcare facilities, as well as disproportionately impact our kupuna, particularly those with chronic respiratory condition, chronic disease conditions. And unfortunately, we've had 2 deaths recently associated with that. I'll even admit that in the state we've had our issues. Fortunately, they haven't become a serious problem. Our own state hospital in Kaneohe has now a total of 3 positive cases reported since late June. Fortunately, all 3 cases were unrelated, and all 3 cases wore a cloth mask at all times while in the hospital. These cases had minimal contact with patients and other staff. They were construction workers, supervisors, and even security personnel. And they all sought testing as soon as they felt symptoms, stayed at home from work, and reported their situation quickly. They acted responsibly and minimized the risk to others. But this is what we're going to see going forward, and I think the way that people should be responding to these cases, which will come up. Report them quickly, and by all means, if you're not feeling well, stay home. The Department of Health has more than 179 contact tracers available for surge capacity. But without community support and everything that everyone is doing to prevent the disease, our healthcare system could very well be overwhelmed, and deaths in the state will increase. We are very privileged to be in a situation where we have the fewest number of cases per 100,000 and the fewest deaths, even with the 2 reported last weekend, than any other state. No other state's even close to Hawaii. So we need to keep that way. We need to be sure that we're supporting our economy, but we can only do so if we're successful in keeping the state healthy. And that means everyone needs to do their part in preventing the spread of COVID-19. Thank you very much.
Thanks, Dr. Anderson. We'll open it up to reporter questions now.